I'm really quite excited about not just this project, but what this project is doing for our main services, our mainstream services. This project has, in some ways, been a driver for change to actually make us change our whole community services. We've got a group of people who are passionate, excited, committed and talented, working together to try and change services to be better for people. And it's very exciting to be part of that team, and it's a pleasure to work with such professionals. If you're receiving care in your home, you might have someone in health come and visit you in the morning and someone from social care come and visit you and do very similar things. Actually, integrating our services means you might have just one visit instead of two. You don't want to have to deal with our organisational differences. You just want the right care in the right place by the right person. Integrating our services does that. Coordinating them just means we carry on doing the same things but know what we're doing.
The establishment of the locality leadership groups have given some of us the opportunity to work with social services and gain some sort of understanding of the rules and regulations they work under, some of the constraints they face and some of the frustrations that they share with us in delivery of health and social care. It's also interesting to note that the information that we share is really kept quite separate, and this is a major sort of problem that we face. Using the PRISM analysis tool, which we're evolving, we are working with it now, we're getting very excited by its use. We can really target health and social care delivery at the people most at risk, and we can then deliver health to those people in a timely fashion before they run the risk of hospitalisation. Working with social services, we're quite excited at the prospect of getting this data that we're beginning to share, evolving this PRISM tool further to enable us to really target people most at risk. I think by doing this in a very sensible, structured way, we can improve their health remarkably. This is the demonstrator site. I hope that this is successful and can be rolled out then throughout the country.
Some of the problems that people with respiratory disease suffer are very multifaceted. It's not just a question of whether they can blow quickly or whether they get breathless. For example, diseases like chronic obstructive pulmonary disease affects every part of the body. So you need a multidisciplinary approach to be able to deal with all those various issues. Also, people with lung conditions often have many other conditions as well, which may or may be related to their lung problems. So you need a whole team and a whole raft of experts working on patients to improve their quality of life, to improve their functioning. It's not just a question anymore of giving people tablets or inhalers. We do work well as a group, but there is still too much overlap where we are replicating each other's work and each other's knowledge.
Telehealth in the rural situation is particularly a good idea. We have teams that come out and see patients, but we have a large number of patients, and using telehealth to monitor people, we can actually reduce the number of visits we have to go out and see them, and it also encourages us then to be able to take more patients on our lists. It's also good for the patient because they understand that we're monitoring them, keeping an eye on them, they feel safer. They're also taking a bit more control and understanding their own disease process. The other areas that are really good for us is that we can also use the telephone a lot more, because we can look at the system in our offices and speak to the patient on the phone and reassure them that way. If you speak to most patients who have a chronic condition, they'd like to stay at home and be able to receive their care there, and utilising telehealth, we can do that in a much more efficient and suitable way. First of all, the patient doesn't want to visit if they're well. They want you there when they need you, so that's one good way of reducing the visits, but it also enables us to see a lot more people, because then we can see the right people at the right time in their home, which for them is the right place.
It is reassuring because you know that when anything is wrong, they will pick it up and either come and see you or notify you when you're through the machine. My family are really happy with it because they don't have to worry so much, because they know somebody else is monitoring me all day, which is good. You don't have to have a doctor about all the time. I'm going to be back and forth surgery, no hospital appointments, no nurse calling. So it definitely gives you more freedom anyway to get on with life.
The CDM team was set up really on looking at where our problem areas were in terms of emergency medical admissions within Carmarthenshire. So it highlighted the patients that were being admitted more frequently, and then we looked at what evidence there was then and what services we could implement to try and improve their care to stop them coming into hospital. Telehealth will be beneficial for patients, and it'll give them more confidence at home knowing that they're being monitored, and hopefully it can help staff then intervene at an earlier stage if their chronic condition is deteriorating, to stop them maybe being admitted to hospital or having a severe exacerbation.
It was nice for somebody like myself as a layperson and a patient to see the way they were going with it, with the C4, and it's nice now that a year and a little bit on to be able to see that what was identified as what they needed to do is now not only in place and in practice, and they've designed the practices that they are employing today, but also they've fine-tuned what they are doing.
There's a huge amount of commitment amongst the professionals. They really are doing what they ought to be doing, which is identifying what needs to be brought together, what needs to be coordinated, where the duplication needs to be ironed out. And also, the aim is to take patients with chronic conditions and make sure that the services that we give them are actually appropriate to what they need. And if they can manage their services better, then hopefully we can keep them out of hospital. They will have confidence that they know exactly who to contact about things, and it's going to improve their lives. I have high hopes. I just want the project at the end of the time, where it's given very good evidence that it works, I want it to be rolled out across the rest of Wales so that everyone benefits from the work that we're doing.
Long term, in terms of what we're going to see in Carmarthenshire, is that we'll be able to provide more services, particularly to older people in need in the county, by using our resources to best effect. Rather than duplicating and having people doing essentially the same job in the same streets, they'll be working together to make sure that they provide a range of services that perhaps at the moment we've not been able to provide right across the county. I think the Demonstrator project has certainly been a good thing for us. It's enabled me, for example, to talk to NHS frontline staff as well as my own staff on behalf of NHS management. So I actually had the opportunity of addressing those staff as being the only chief executive out of 3, but talking about a project that we'd all agreed about, a joint project. That wouldn't have happened without demonstrators like this particular project, where we're focusing on our teams working together.
Some of the important elements of the chronic condition management project is the fact that it's getting down to a local level. It's looking at the people within that locality. It's looking at the needs of those people. It's then looking at the resources, the skills, the professionals that we have. It's looking at the issues of where there's overlap between what people are doing. It's looking at how we remove the duplication. It's about streamlining, and it's getting people to work together in a more effective way. It's about people sharing knowledge, sharing practice, and sharing their understanding of what the local issues and problems are.
Integration is vitally important. It's a really exciting time. If you go back a couple of years, you wouldn't get health and social services working around the same table. Not only are we working now, but we are really moving ahead and making sure that we are delivering far better services to the people. They deserve the best, and that's what we intend to give them. And it's by working together, the district nurse and the social worker and also the GPs. It really is an exciting time. Just think that all those people are now working, and so the people who are delivering services and the people who are receiving services, they don't even know who's knocking on their door, but what they know is that the service they're getting is the best. The new demonstrator will be showing that we can deliver far better services within the financial constraints that we have. Everybody now is not looking at just ill health, but we're also looking at preventative and keeping people much healthier, keeping them much longer in their own environment, in their own homes, with all the capacity of living there happily, and also making sure that people live longer.